Hello everyone, welcome to today's webcast. My name is Sue Barros and I am Director of Admissions for Tulane University School of Public Health and Tropical Medicine. And today's topic will be a practical experience at the Office of Homeland Security and Emergency Preparedness. My guest today is Assistant Professor Stephen Murphy. Hello, Dr. Murphy.
Hi, Sue.
Would you like to introduce yourself to our guest?
Sure. Hello, everybody. My name is Stephen Murphy. I'm an assistant professor in the Department of Environmental Health Sciences at the School of Public Health and Tropical Medicine. I'm originally from Georgia. Got my undergraduate degree at UGA, go Dogs. Came to New Orleans for my master's degree in 2005, right before Katrina. And so I had a unique experience in that area, kind of led to my career path change, and I finished my PhD after a few years of working in the field. And now I'm a faculty member, so glad to be here.
Well, thank you for joining us. Let's talk a little bit about the Department of Environmental Health Sciences and particularly in disaster management.
Okay, sure. So the Department of Environmental Health Sciences kind of covers a gamut of exposure sciences. So anything that you may be exposed to that may lead to an adverse outcome or not, chronically or in an acute fashion, and certainly disasters fit in that space. The disaster management track within this department was formed shortly after Katrina, kind of on the heels of all the policy that came out of that disaster locally here in New Orleans, as well as some of the federal policies. It kind of morphed a little bit, but in 2007 it really became one of the strongest programs out there, one of the first programs with a focus on population health.
Sure.
And that's kind of where we have dug our heels in and continue to march forward. And we hope to continue to learn through various research and various experiences in life to help further our experience for the students.
Well, Dr. Murphy, I understand you were instrumental in establishing a partnership with the Office of Homeland Security, which we're located here in our City Hall in New Orleans, correct?
Yeah. So ironically, when I was a master's student back in the day, one of my classmates turned out to be the director of this office. And I too, as hopefully some of you viewing this will be a student one day and seeking a practicum experience. So I too was seeking that experience as a master's student several years back. And he offered me an experience here, and that experience led to a second internship, which then led to a full-time job as being the first person to focus on public health preparedness in this office. That kind of turned the tables a little bit, and he and I kind of put our heads together with the department chair, Dr. Maureen Lickfield, and kind of established a soft partnership, a very strong relationship, nothing formal, but something that continues to bring our students to this space for internships, for practicums, and things like that. I'm fortunate enough to have known the leadership in this office since Katrina, the current leadership, the guys here that are helping put this show on and have the screens behind us here, Tom Shrilla there. I'm very fortunate to still remain close colleagues with these guys and gals, and so it really helps our students get a real good learning experience as they go through the theory and some of the educational pieces in school.
Well, we do appreciate the space here. I think it's lovely.
It's a fun space.
Can you tell us and our audience, why is studying emergency preparedness and disaster management at Tulane a great place to be doing that?
I'm a little biased on that response, but I think some would agree. New Orleans is kind of the nexus of several things that could potentially be going awry. We're at a very focal point of hurricanes on an annual basis. We get a lot of those. The threat is always there. New Orleans has about 800 festivals a year. Just kidding. It seems to be at least twice a day. But those mass gatherings present themselves with unique challenges that public health preparedness and Homeland Security and emergency management professionals have to be aware of up front. We are very, very much vulnerable to climate change and any kind of sea level rise. We're already losing, our coastlines. We're going through soil subsidence here in the city, kind of a little bit of a sinking element to exacerbate any coastal erosion and any kind of sea level rise. So anything and everything. We have a large port that's also painting us as a potential target for any nefarious activity, any kind of bad bad guy, bad actor. So the threat matrix is very unique here in New Orleans, and we learned a lot during Katrina. We like to think that we corrected a lot of the things that may have been incorrect in 2005, and we've kind of learned a lot. We learned to play with a lot of different stakeholders. We learned to plan with them and respond with them, and so I really feel like those can be leveraged and really, really enhance the students' experiential learning process.
Okay. Well, Dr. Murphy, it's been about 15 years since this program has been in effect for disaster management. Let's talk about a few of the careers that you know that our alum have entered.
Sure. We have a few that have actually gone into academia. I'm one of them, I guess, at this point, for sure. So we have several that have gone into assistant professorships. We have some that are at state and local emergency management agencies and public health offices, whether that's a health department or an office of public health, depending on how your state is actually structured. We have some at local offices of emergency management or public health offices or health departments in charge of preparedness activities. We have folks all the way out in former San Mateo County, California, all the way to Sandia National Labs, all the way to Washington, D.C., where we have folks in the Office of Countering Weapons of Mass Destruction at this point with DHS. We have folks that were at the CDC. We have folks in the Public Health Service. We have graduates that have gone on to NASA. We've had aerospace medicine doctors that have come through the program to get their masters on their way to becoming, the way to aerospace medicine in their fellowship. So with the Navy, with the Air Force, and the military services in that regard. So we feel like we cover quite a spectrum.
That's very broad.
It's very broad.
Let's shift a little bit and talk about how did Tulane help shape your career?
It shaped it tremendously. As I mentioned, I moved down to New Orleans right before Katrina hit. I had about 6 weeks, period to enjoy New Orleans pre-Katrina. And I moved to just get used to the city a little bit early before school started, before my master's degree here. And 9/11 had previously kind of reshaped where my post-undergraduate degree was going to send me. And I went through a little bit of a shift because of that. I felt a little bit of a call to duty. And so when I moved to New Orleans, that call to duty was even more, it zeroed in even further for me and allowed me to really focus on where I wanted to spend the next, chunk of my career, or should I say all of my career.
Right.
New Orleans really did allow me to do that. A lot of my colleagues and friends and former supervisors paved the way for me. They really allowed me to do that, and I want to return the favor with those connections. But I feel like Tulane is absolutely positioned in the right city, in the right place, for folks to really learn these types of careers.
Oh, that's an exciting career path for sure, and it's amazing to hear that you were here for Hurricane Katrina and got to experience the gamut of that.
It was interesting. I fortunately did not flood. I had several friends that did, and I was able to rent my place to them when I was remote located, for a while. I found my space at a different university for a while and then returned, and that's I feel like I experienced quite an interesting shift there. And the city was just in complete ruins almost, and it was just one of those moments. And if you didn't feel lured back, I'm not quite sure why you would be in public health, So it's one of those things that I feel like there was just a calling back to New Orleans for some of those folks post-Katrina, and they wanted to be part of the rebuilding process, and New Orleans is continuing to be a better city every day, I think.
Well, we're definitely glad you came back.
I am too. Thanks for having me.
Well, for our prospective students in the audience, what advice might you have if they're interested in studying disaster management?
Sure. Disaster management is kind of a broad term, broad phrase, and there's a lot of things that can go into that. We look at psychological components, we look at crisis communications aspect and how we communicate not only internally with the first responder community, but also to the public, and how that message gets not only delivered, but the uptake of that message, how we can improve that. So not only are the operational pieces and the threats and what those mechanisms of injury may be, or those exposures may be, we look at the gamut of what happens in the recovery phase all the way back up through the preparedness phase. So if you can get any kind of experience along the way, the Red Cross is a very good spot. They do a lot of volunteer experience. I know New Orleans is really rich for that, and your home state or home city might have a big presence with the Red Cross. I would encourage them to go and knock on doors as you go through your learning experience, wherever it is in the undergrad or another master's degree. Don't be afraid to knock on those doors at offices of emergency management or Homeland Security or public health or offices, health departments, even hospitals that have an emergency management division. Go in there and ask them if you can kind of shadow somebody or just get some sort of volunteer experience. It will further your ability to apply those lessons and that kind of connection with that person or that agency as you matriculate into the university in a master's setting. It will make you possibly allow you to identify not only what you may want to do, but probably more importantly, I don't want to be a part of this, or I know I don't like that. It might help you kind of hone in on where it is you want to spend your time. And I think that would be an improvement for anybody that wants to study something at a level of a master's or even higher. So,
Thank you. That's fantastic advice. Thank you. Well, I'd like to thank you for taking time out of your busy schedule and joining me today for this interview.
thank you very much for having me. It's been a pleasure. Glad we could do it.
And thank you, audience, for joining us. We have been coming to you live from the Office of Homeland Security and Emergency Preparedness in City Hall in New Orleans. I'm Sue Ross. This is Dr. Stephen Murphy, and we'll see you next time.